Good morning. I call to order the high-level interactive dialogue on the social, economic, and environmental determinants of health. I would like to warmly welcome all of you to this meeting. In accordance with Resolution 78/280 of 2 May 2024, this interactive dialogue will provide, under the theme Global Health and Foreign Policy, addressing global health challenges in the foreign policy space, an opportunity for member states and the relevant stakeholders to discuss and promote structural change, strengthen their political commitment, and foster multi-sectoral coordination and implement health in all policies for building a healthier and more equitable future. I'll now make the opening remarks. Excellencies, ladies and gentlemen, thank you for joining today's high-level interactive dialogue on health determinants. I'm honored to deliver these remarks on behalf of the President of the General Assembly, who sends his sincere regrets for his schedule did not permit him to attend this important dialogue. Excellencies, in our efforts to achieve universal health coverage for all, we must remember that health does not begin in hospitals. It begins in homes, schools, and workplaces. It begins in ecosystems and contexts within which we reside. This means that to truly leave no one behind, we must address all health determinants, whether in the operating room, the boardroom, or the classroom. We must confront the deeper structural forces that shape our health and well-being, and we must leave no stone unturned. While there are many contributing factors to overall health outcomes, the fundamental reality is that our health systems are only as strong as the social, economic, and environmental conditions that support them. There are many areas in which we are falling short. The latest research confirms that there is an acceptable 33-year life expectancy gap between and within countries. Nearly 70% of workers globally lack access to sick leave, despite clear evidence that this is essential to health. And 26% of global deaths can be attributed to environmental factors, most of them linked to non-communicable diseases. Excellencies, delivering quality health care is made only more challenging when critical determinants of health impede progress. These include the escalating impact of climate change, of natural disasters, the absences of adequate nutrition in local communities, labor and governance systems that fail to prioritize the health and well-being of workers, and the deepening crisis of income inequality. This last point is particularly troubling. Children from low-income families are among the most affected, suffering from limited access to prevention, diagnostics, and treatment needed to ensure their health. Excellencies, looking ahead, we must take urgent and coordinate action across actors and economic sectors to address the many and complex determinants of health. This requires a holistic, inclusive approach involving women and girls, young people, older persons, and the civil society organizations. And it calls for efforts to ensure health determinants are addressed across all sectors through comprehensive policy and legal reforms, stronger social protection systems, more resilient healthcare systems capable of withstanding the shocks of climate change and disasters, and determined efforts to overcome isolation and marginalization. Above all, it'll demand bold steps to close the inequality gap that divides health systems into those who can access care and those who cannot. Excellencies, strengthening healthcare systems must be a collective, continuous, and adaptive process, one that fully recognizes and addresses the determinants that shape our health systems. Only by working together and by addressing these factors in a comprehensive way, we will build health systems that reflect the goal we all share: universal health care coverage for everyone and everywhere. I thank you.